Welcome to this recording of the EFC webinar on reopening churches in Canada. I'm Karen Stiller, an editor with the EFC's magazine, Faith Today. What a strange and challenging time it's been for Canadian churches from coast to coast. As provinces begin to emerge from the strictest of pandemic lockdown protocol, we wanted to host a conversation between a panel and also take questions from viewers representing churches from across the country. And we really wanted to just learn from each other. So our panel was Dr. Cami Condola, Chief Public Health Officer for the Northwest Territories, Dan Goddard, Lead Pastor of Victory Church in Moose Jaw, Saskatchewan, Troy Matchett, Pastor of Grace Church in Batuque, New Brunswick, Rick Burdett, COO of Outreach Canada Ministries, and Bruce Clemenger, President of the Evangelical Fellowship of Canada. We were so grateful to them, and we received lots of great questions from the participants. We had a little difficulty with our Zoom recording, and so what you're about to see begins about 20 minutes into the webinar, but we think it still holds some really valuable information that you will benefit from. So we're sorry that that happened, but we hope that this webinar is of help to you. Thank you. Sent in a question earlier this week about if you have to remove your mask to receive communion, then maybe that's not good. I know in New Brunswick, I saw within the Anglican Church, they were advising, like, just communion would only be bread and not wine. So do you have some feedback on that?
So when you look at, and I've been a believer for decades, for close to 34 years, and everything that COVID would love is what we do in church. We congregate, we share food, we pass collection plates, sing, we hug, we cry, we kiss, we share hymnals, and so it's almost like you have to step back and from my point of view is pretend you're the virus and pretend if you're how many touches do something get. So if you're sharing communion and it's being passed, well, if someone wiped their nose and didn't wash their hands and they're touching it, you're picking up that virus. And if you inadvertently touch your eyes, nose, and mouth, and you essentially incorporating that virus. So one of the things is, how can we maintain that activity and decrease the risk? So there are ways that people can share the bread and the wine, which is an integral part of our belief system. Is, can you develop individual packets and go row by row? So people go up, they pick up their bread, they pick up their wine. In our church, we have little plastic containers, and you have, and they're individual, and then they return back in another mechanism. So the flow goes like this, they come back to the rows. So they're participating in the communion, but it's the least touch. Same thing can be done with collection plates, is that when it comes time for collection, people can go up and put their collection into a receptacle and let that sit for 24 hours because you don't know where people's hands have been. And you still can do collection, you can still do communion, but it's the least touch mechanism.
Okay, so Dan and Troy, how is this resonating with you? Is this jiving with what you were thinking in your plans of reopening? And go ahead, Dan.
Yeah, just thank you, Dr. Condola. That's very helpful. And, you know, it is hard to hear, right, for us, because these are the methods that we've used for years to worship together, to connect together, to grow together in Christ. But at the same time, I think it's challenging our methods, and maybe that will be a good thing in the long run. Maybe we'll learn to accomplish our mission with some new methods. You know, sometimes we don't get to change our methods because we're so used to them and we're so comfortable with them until we're forced to. So this is challenging for all of us. But what the doctor shared there, I think, is you know, we're not the experts, they are, and we need the humility to listen to those things. And I do also want to just add our community perception is important. You know, right now our communities are concerned about large crowds, and they probably should be, or whether they should be or not, they are. And so for us to just sort of wildly jump into large crowd gatherings may not be perceived as a loving, gracious, shining act. And I think as churches, we should be considerate of that.
Yeah, I think that's really a good point. Doctor, is reopening realistic for churches with 150 people before herd immunity through vaccination takes place? Maybe you could, yeah, just talk about the whole herd immunity question for a moment.
So it is a difficult question. So what we know about this COVID-19 virus is that some people do develop antibodies, but we don't know how long that immunity lasts for and whether that immunity can wear off and people can get reinfected. We also know coronavirus is notoriously very difficult to develop a vaccine for. We've all went through SARS, and the vaccine may be 2 years out, not to put a damper on people. We also know, because we don't know so little about immunity, we do know that in Canada, not a lot of us have developed immunity because of the public health measures, because of containment. We have like over 91,000 cases, but that is not, by no means, it's just a drop when you look at the Canadian population. That what my concern is around the second wave that will come in the fall. We have been relaxing measures, but there is, come fall, when everyone starts to come back inside, we know that community transmission will occur. Last daily count yesterday was only 705 active cases. It's good, but in the summer, people are outside, it transmits less. It doesn't mean that the virus does not continue to circulate, especially in provinces like Ontario and Quebec, where they have high numbers. They're still getting cluster outbreaks. So we know that when you, in the fall, when people tend to return, what we've seen with pandemics is we have a very small spring wave, then there's a lull over the summer months, and then it gets ferocious in terms of the fall wave. It can be very intense. We can have a higher magnitude. In that type of wave, you would get considerable number of people immune, but it's hard to say would the 50% of Canadians exposed, and if it would, that would be a very bad pandemic because the health system would be overwhelmed. Yeah. So what we have to look back is back at the first century church and decide, how do you keep our fellowship going? What is church? Is church a building, or is a church a community of people? We do know that there is an allowance across Canada of allowing small groups to congregate indoors. I'm not talking about community indoor gatherings, but 5 to 10 people. There's online communities for those people who are elderly and have very serious pre-existing disease. Is knowing that this could be 2 years out, knowing that we don't have herd immunity, knowing that we're going to go into a second large wave, knowing that we have a breath over the summer. How does the church redefine itself to keep a community strong that can be resilient against whether some provinces go back into containment or not? How do you redefine what church is over the summer?
Yeah, that's good. Very good point. Doctor, can I get you to share your thoughts on nursery and Sunday school? And then Troy, I'd like you to pipe in about what you're thinking about nursery and Sunday school. So several people are asking about how we protect our children, and I guess how we protect ourselves from the children maybe too.
So with the nursery and Sunday school, my recommendation is to look at the specific guidance for daycares and specific guidance for school settings. So it's about things. It's going to be the same hierarchy controls, which is physical distancing, engineering controls, the administrative controls, and PPE and infection prevention. Those are unique across any scenario. But when you apply it to a nursery, or when you apply it to a Sunday school, which would be like a school setting, there's something unique about that population, and it would be about the types of how people share toys, spacing, and the protection of the day home staff. So you would have to not look at guidance specifically for churches, because some of them miss those. Is you have to take the guidance for like a day home, or a guidance for as return to school setting, and then apply that guidance to your Sunday school and your nurseries. I'm
Very
a
helpful.
teacher, so it's something that I've always loved to do. And in my scenario, I would over the summer, I would want to do it outside as much as possible.
Okay, thank you. Troy, how does that sound to you and your church?
Yeah, I think that's amazing advice. I think one thing that we need to, we go through this whole shift, is we need to, I think more than ever, I think it's always been like this, but more than ever, I think we need to marry the mission and date the method. Like, the method's always going to change, and we're just in the midst of a shift of the method, but we're married to the mission, and the mission is to see people come to Jesus. Whether we do that outside or inside, in big groups or small groups, it's almost irrelevant. And so I think we just need to always keep the mission in mind. For us, it's difficult because we have, not a very big church, 150, 160 people. We have a lot of kids.
I would say that's pretty average sized church in Canada, though.
Yeah,
so,
it's probably a little bit above average, but I'm just saying, so we have a lot of kids. And so this information today, I think, can be so valuable with the daycare using as our guidelines.
Yeah, that's super helpful. Thank you.
The guidelines are super strict at daycare, so that's a bit eye-opening, but
yeah,
that's I think good. We just need to marry the mission and be creative.
Yeah, no, that's really helpful. Someone has asked about, does it make sense to just ask the most vulnerable members of our church to stay at home, to protect them? You had mentioned having them drive up in the parking lot of the church, for example, and like our church, which is in downtown Ottawa, doesn't have a parking lot, for example. So there's all these, of course, we have to think beyond that, but does that make sense, Dr. Condola, to just ask the elderly or the frail to stay at home? But sometimes they're the people who have problems digitally, not to stereotype, but.
There's a lot of unintended consequences from this COVID-19 response, and when we went into containment, and the unintended consequences is by protecting the most vulnerable, we've put them at highest risk for mental health, for depression, for being disconnected. And we want a life worth living. We're supposed to be the light. And one of the our phrases that's always been like physically distant but socially connected. My one big fear, and in our church in NWT, we do have parking lots, and the reason why, and I can't speak for other jurisdictions, the reason why I would encourage an elder to be in the church in a parking lot just listening is that sense of visual connection. If we start asking, and we have to exclude our extremely sick staff and our high risk population and elders, but if we exclude them from sight, we exclude them from memory, and then we have to jump in and think, oh, how do we connect with them in a way that they're still part of our congregation? So that's where people have to be creative. In downtown Ottawa, it may not work, but is going to their house, and where you're 6 feet away, where you're outside, and you're engaging with them if they're not digitally connected. But you'd be surprised at how many elderly people are digitally connected. If there's someone in their home that could help them digitally connect, that would be great. And if they can't be, then try to figure ways out that we can still connect with them in a way that they're remembered. And that's the fine line.
That's really good. I love the idea of even like now, as we're sort of allowed to more easily visit outside, to have teams go to the homes of seniors. That sounds like such a good idea. Bruce, what are you thinking as you hear all this and think about the churches that are, affiliated with the EFC, and just the huge challenges that lie ahead for pastors and ministry teams in particular?
Yeah, just on the last, a number of things just spurred by this conversation thus far. This has been rich. we used to call them shut-ins, the people who couldn't regularly attend church. I think now that we've all experienced what it means to be shut in, hopefully as we develop new practice and habits, ways of communication, online services and so on, that it will make us more mindful that when the time comes that we can gather in larger and larger groups, though that may be a long way away, that we don't forget what it's like to be shut in, and that those practices, technologies, activities that we've generated to maintain in contact with people who are shut in, that we'll continue those and find ways to carry that on. So that, again, my concern is that as for many, as restrictions lift and we move back to the new normal, there's a lot that are going to be left behind. And we need to continue to remind those. Another theme I hear, again, Troy talked about mission and method. I was thinking about activities, purpose. Dr. Kendra talked about going back to the first century church. I think it's what we're doing, and maybe we can have more robust conversations, coordinate some conversations across Canada, is rethinking what it is to be the church, and distinguish what's the purpose, what's at the core, and then what are the activities that we're just used to doing. And is a litmus test whether we're back to normal, that we're doing the same activities, or that we're doing different activities but fulfilling the same purpose. So I think we need to really consider that. And I think the last one is, this is a wonderful opportunity to remind those around us about the benefit of the church. All the studies we've seen indicate that the church has a positive net contribution to the broader community. And we need to keep our minds on the community, not just on ourselves and the mechanics of how do we reopen and what can we continue to do, what we should not continue to do. But we have, again, we're a really connected group of people. We organize things well. We have good communication systems within our congregations. How can we should be going to the public health authorities, to our municipalities and saying, this is what we're doing, check on us, our ventilation systems, and sort of the practical things. This is what we're planning to do. Does this make sense to you? So let them know that you're taking the advice seriously, but also saying, how can we serve you? These are our capacities. How can we serve you better?
I love that idea. Speaking of ventilation, we do have a couple of ventilation questions. So are you trying, Doctor, when you ventilate a room, I don't know if you can handle this question, I'm sure you can. Are you trying to vacate the room air or bring in fresh air? So is it about air going out or air coming in?
I think it's about air exchanges, how quickly you can purify the air. So for instance, if you're having 2 exchanges per hour, if someone is, let's say they cough, they sneeze, and they aerosolize their room, it takes a while for those droplets to go in, and the better your airflow exchange, the more you can purify the air. And so for specific ventilation, the simplest one is like open the window, like if you can summer. And then when you're looking at your air filtration system, you need an HVAC expert, of which I'm not. But you need someone who can actually look in at your and say, yeah, the air is being exchanged at a good enough pace that it's getting a fresh intake and flow. Think about being on an airplane. You want a good airflow system, a purifying system on an airplane. You wouldn't want to be sitting there inhaling your neighbor's hacking cough, all the aerosols, which I recommend wearing a non-medical mask on flights, which is mandatory. But it's about taking the stale air and putting fresh air intake so that you're taking out as much virus particles and stuff as possible, or they're helping them settle down. And that's not my expertise, but it's one of the physical engineering interventions people can do. And this is we're recommending for dentists and for healthcare facilities, but it's a good one for churches.
Yes, thank you. And we have had a couple of like how to clean chairs and fabric questions come in, and I'm going to suggest that that probably you can get better advice for that online and by looking at public health guidelines. There was a question earlier on about the difference between creating content versus community online, and I wondered, Rick, if I could invite you in to just take that on a little bit? Like how are we, it's one thing to stream, it's another thing to maybe serve online. What are your thoughts on what you're hearing so far, and also just that topic of content versus community?
Well, one of the things that we're seeing churches do as they pivoted into the COVID is how do we help our senior population? How do we help our children? So there's not only the online programming, but we are seeing churches put into practice just picking up the telephone and being in contact with as many members as possible. And then what happens is those people are able to share some of their issues and some of their problems of here's what I'm facing. And so we're watching many churches across Canada and in the US develop hotlines where church members will go out and they'll do the shopping for people, or they'll pick them up and they'll take them someplace that they need to go. You know, we talk about when we reopen the church, how do we take care of the elderly, the at-risk population? Well, that's something we need to be doing right now while we're in the lockdown mode. And I think as we practice those kinds of issues, we will see that when we come back together, that people they're now experiencing something new. They're now experiencing community in a different way that they never did before. Community groups, I think, are thriving in this online Zoom era. In our church, we're watching our community groups actually grow. People who didn't want to come and be a part of a group because they're intimidated because there's this group of Christians and we're not quite sure what that's going to be like. Well, they can come and join in Zoom and they get to experience a little bit of life. So that shift of content to digital, I think is affording the church a great opportunity to actually expand that into the future.
Yeah, thank you. That's really helpful. Someone has commented, and this is such a neat idea, about having a 1-888 number that their church subscribed to. Our Church of 400 purchased a 1-888 number for $50 a month and have 30 of our 50 non-internet congregants listening every Sunday. So that's a great practical tip that I certainly wasn't aware of. Thank you for that. Dan and Troy, a couple of people have asked what your actual reopening plans are. So if you could maybe just sketch them out for us, not in a lot of detail, but you know, if there's anything in particular you think maybe other people haven't thought about that you could share, that would be great. Dan, do you want to go ahead?
Yeah, sure. I'll start, and then maybe
Thank you.
Troy will have some things to add. First of all, we think it will happen in phases, just like the rest of this is going. So likely there'll be a phase 1, phase 2, phase 3 of reopening when that takes place. Second of all, we probably think there will even be a pre-phase, sort of a time of training our staff, our volunteers, doing some services where we wouldn't make them open to the public in that sense. They would just be the 30 people or 50 people, whatever the max is, but it would be people who are getting trained to follow all the systems that were being recommended. So those are two things that we've thought about, but as far as dates go, we still don't have any much clarity on that. So I'll let Troy speak to anything if he's got any more.
Thank you. Troy?
Well, Dan, I'm going to steal your idea about the service for the people you're training. So thank you for that. That's a great idea. For us, it's a little bit looser here. So we're expecting on Friday to be able to gather with 50 people. I say this, I mean, churches, if they gather, they're going to work through that at their own pace, and there's no judgment on my part. And for us, we stopped kind of a week earlier. We really believe that where we are in our circumstances, we just felt like that was the right move for us. Our thought process, well, you know, this is a way that we can love our neighbor by keeping them safe.
Yeah.
And so we're going to be slow to re-implement for the same reason, that we love our neighbor and we want to just be slow and to be wise. We really want to lead the way in a lot of things, but this probably isn't one of the things that we want to lead the way in. So we're being cautious. If it goes to 50 people outside, which we're expecting on Friday, we're going to really concentrate on the 10 people inside and the 50 people outside for fellowship, for connection, for campfire type services. And we're going to really try to hit that hard in the summer. We've made a decision to stay online till Father's Day. And then if the number changes to something that we can work with, our plan is to give a 2-week warning to our church that will be coming in person in 2 weeks. And this is what it's going to look like.
So I just want to remind people that Troy is in New Brunswick and Dan is in Saskatchewan.
Yeah.
Just in case that's helpful. Keep going, Troy. Thank you.
Yeah. So we're going to give a 2-week warning. That'll let us get our building in order and get all the things that the doctor shared really set up. And then
thank you.
And we're going to go from there.
Yeah, I love the wisdom of you don't actually have to be the first. Yeah. There's a lot we can learn from other people moving ahead. So there was a great question about insurance companies. Are there things we need to talk with our insurance company about related to reopening churches? I don't know who would like to take that. Dr. Condola, is there some wisdom in that?
The one thing, I think you have to talk to your insurance companies. The one question I would ask is if inadvertently a church was involved in a cluster outbreak, what your protection is. Just FYI, if you've done everything right and you've met all the requirements, that may be something to just consider asking.
Thank you. Here's a question about, this is more related to ministry. Any advice for churches that have things like English as an additional language teaching program, intensely close interaction? I mean, I guess the advice is going to be follow the advice of public health guidelines. You still have to keep that distance, right?
Yeah, it doesn't matter what. COVID doesn't have a religious identity, it doesn't have a language. It doesn't care. All it's looking for are warm bodies stuck inside with poor circulation and one or two people sick, and then there you go. It's this. He's apolitical, a-religious, and a-linguistic, if that's a word.
Good. Somebody has said, why do we keep saying reopening the church? Just, of course, assuming the church is closed. The question assumes something that is problematic. Can someone suggest a way to restate the question in a more nuanced way? That's interesting. And I also, Troy, you mentioned, I'm gathering from what you said that you're going to stop digital streaming of your services. And I know that's something being discussed. What I've gathered is churches feeling like they're not going to stop going online, that if they made that pivot, they're going to stick with that pivot. Rick, have you sensed that? And then Troy, you can answer if I've misunderstood.
We've done some informal surveys, and we found that 75% of the churches have either made a decision to continue or are considering to continue.
Okay.
And about 25% have said they're gonna stop. I think the challenge is we want to be together. We want the physical contact, and it seems antithetical that you would continue the online. But I think wisdom says God's given us this ability to do things online, to reach people who may not come to church no matter what, and they get a chance to get exposure to the gospel. So I think most churches, at least 75% of our polls are saying, we're interested in continuing to figure out how to do this together, both in person and online.
Thank you. Bruce, do you want to comment on that?
Yeah, I think it's, I mean, publicly we're known for the Sunday morning gatherings. I mean, that's why the big chunk of our church building is dedicated to a large sanctuary. But that's not the only thing we do. And so I sometimes bristle at the word of, the idea of church reopening when they are open. Many churches are engaged in any way, in every way they can, and their staff are looking at long hours. It's just the way they conduct ministry has been changed significantly. Also, often hear the conversation about religious freedom. And in many ways, religious freedom is kind of an amalgam of all other freedoms. I mean, all the other freedoms listed in the charter: conscience, thought, belief, opinion, expression, assembly, association. all those kind of are engaged with religious freedom. That's why religious freedom is often called the first freedom. That when any one of those other freedoms is compromised, it's going to affect religious freedom. But we do have religious freedom. It's the freedom to assemble that's been restricted for valid reasons. So I think we need to realize that the church is engaged, that we are the church. It's not just the building. And the building itself, staff, many churches still continue to function in creative ways. So it's the kind of the phased moving back to, again, those large gatherings, which could be considerable time away. So as we realize that, I mean, the doctor mentioned, Camilla mentioned, Canola, sorry, mentioned a little while ago, this could be up to 2 years. And so we really need to think through, what it means to practice church, to be on mission in the foreseeable future.
Yeah, thank you.
Just to clear up one thing, Troy, here. No, we are definitely going to stay online. We're definitely looking at it as like we're planting a campus. Like, I don't believe there's any way we can go back because of the reach and because of everything that we've seen happen. So.
Good. Thank you. Sorry, I misunderstood what you said there. There's a good comment. We're not reopening, we are regathering. That's a nice term to use. Dr. Candola, there's questions about masks and how you reuse a mask safely. And I think we'd all love to hear that and how you properly wash it.
So there's some excellent guidance on the Government Canada website on non-medical masks. How to don it. We call it don it. It's like there's different ways of masks produced. Some of them have the ear loops, and you hold it from the ear loops, you put it on, but you don't put your hand on the mask itself because you recontaminate yourself. But you have to make sure you wash your hands or use hand sanitizer, 60% alcohol when you don it off. You need to carry a plastic bag and a brown paper bag with you so that when you take it off, you can put it aside in a protective layer. Wash it at the warmest temperature possible to not shrink the cotton, and then dry it in cool water, and then you can reuse it again. These are the non-reusable masks. The ones I prefer in terms of the non-medical mask is the ones that have a space for a filter. So you could take, those blue Scotty towels or a regular towel or Kleenex, you can fold it over and put it in, and then that 2-layer mask now becomes a 4-layer mask with something to absorb the secretions, and it just increases protection. The whole thing of the non-medical is to hold your secretions in, so you're not spraying your neighbor, you're not spraying surfaces around you, and not to recontaminate yourself. The one single most important intervention that we always have to think about is always constantly washing our hands or using hand sanitizer, because you could be wearing a mask and then touching everything and contaminate yourself. It's like people wearing a mask doesn't substitute hand hygiene or physical distancing.
Okay.
So the specifics on the donning and doffing, which is putting it on, taking it off, type of mask, is that information is available on the Canadian website and the Centers for Disease website, and your own provinces may have that information. The one measured balance that I just want to, is that we're not driven by fear and anxiety, because we serve an almighty creator, and with God all things are possible. At the same time, we are using wisdom. So what we're trying to do, the churches, when they re-looking at the exposure plans, is not create a setting where you could have a super spreader event, knowing that the highest risk would be the elderly and those with chronic weak immune systems or pre-existing disease. But by and large, for the vast majority of people, the bulk of this virus is mild. People, 80% recover without being hospitalization. Of the 20% who are hospitalized, about 5 of that 20% want to go on to needing intensive care unit and mechanical ventilation. So it's not to be driven by a spirit of fear and anxiety, but also you don't want to be that church cluster outbreak.
Yeah, I agree. No one wants to be that church. Okay, we're getting down to the end of our time, and I know everyone here is busy, and I'm sure particularly Dr. Condola, you've got a lot of things to do, and we're so grateful for you for joining us. This is one last sort of practical question, or maybe two together. I'm going to put two together. With hot weather coming, concerned about people wearing masks and getting too warm, can you take the mask? Is it reasonable to wear the mask when entering and exiting, but take it off when in well-spaced, distant pews?
Oh, so when you're indoor and
Yeah,
you're,
yeah.
you're distant, it's if you're not singing or humming and you're there to listen to the service and you're physically distant, it you may not need the mask. Just realize that there'll be scenarios where someone can fall and you can quickly breach that 6 feet. If the non-medical masks are to be used when you have, especially when you can't maintain that 6 feet of distance.
Okay, thank you. And the last sort of really practical mechanical question, if the music team is 20 feet away from the congregation's seating, is that far enough, or do you still need the plexiglass barriers?
So even with the music, you have to realize is they're spraying themselves too.
Okay. Oh, good point.
You know, because you got 20 people, and that's how the choir. There was you can read the clusters, and they could be 6 feet apart, but they can spray. It's not there's a heavy respiratory droplets people can eject, and that falls to the ground, and then there's these very light aerosol particles where the viruses are still on it, and that can go further. But if you're doing a mass choir together, they're all spraying each other and exposing themselves.
Yeah. Okay. So if you're out meeting outdoors and you're maintaining physical distancing, singing is still not a good thing to do, right?
What you should do is figure a way that people can sing where they're not spraying each other, or like it really has to be spacing, physical distancing, other mitigation measures. It's a lot easier when it's a solo person.
Right.
So it's singing is beautiful. It's how we worship.
Yeah.
Look at what you want to do and say, is it worth the risk?
Right.
Can I mitigate the risk, and then decide. It's not excluded by there's precautions put on it in some of the provincial jurisdictions, so you need to look at that, and they have specific requirements around singing. And if you have questions, you can always call your local public health official. The one thing, and if there's no other questions, is there is one form of communication that doesn't need to be done face-to-face. It doesn't need internet, it doesn't need a phone call. And the one communication that's always available 24/7 is a power of prayer. And that communication is always available. And people that we call shut-ins, they're the most fervent prayer warriors that I know. And when I have issues, I always send a text to them. And that communication is always available 24/7. It's like incense to Almighty Father. And never forget that that's always available to everyone. COVID didn't take that away from us.
Thank you. I want you to be my doctor. So, okay, now we're going to wrap up. I'm going to ask every panelist, this is going to sound funny. I want you to introduce yourself again, because on Facebook Live, we didn't capture that part. So just briefly give your name and your position, and then one word of encouragement, not literally one word, but no more than a sentence of encouragement to Canadian churches. And then we'll all thank you all and we'll wrap up. So Bruce, do you want to start us with our ending?
Yes, thank you. Bruce Gumger with the Evangelical Fellowship of Canada. I think we're all on a journey, and I think it's on groups like EFC to figure out how to bring together the learnings and the ideas and the experiences and continue to project those back out. There's been a lot of great ideas, a lot of information shared in this webinar, and I think it's part of our task to keep the conversation going in as many ways as we can, especially as different provinces unfold and lift restrictions in different cadences. We can learn from one another from those experiences and share those. We're in this together.
Thank you, Bruce. Rick?
Rick Burdett, Outreach Canada, work in the operations part of it. I just see that God has opened up a great big opportunity for the church to expand its reach in so many different ways we couldn't imagine. I loved what Troy said. The mission is exactly the same, but the methods that we will use are different. And so just consider all the different ways that God is allowing you to actually minister and reach the lost.
Thank you. Over to you, Troy.
The church was born for this. It was birthed in adversity, and in the most adverse times, the church has thrived. And this should be no different. Be about the mission wherever you are listening. Be creative. Don't marry the method, marry the mission.
Thank you. Dan?
Yeah, Dan Goddard here from Moose Jaw, Saskatchewan at Victory Church. Just want to encourage you to hang on through the change. Change is always uncomfortable, difficult. I'm wired to love change, and this has been way too much change, way too fast for me. Most of our strategies that we used to use aren't working anymore to make disciples. And so we're having to reshape that and find new ways to make disciples. And by God's grace, it's all we've ever been able to do. Anything useful is by God's grace. So by God's grace, with all the rest of you wonderful evangelicals in Canada, we are going to continue the mission. Thank you.
Thank you. Dr. Condola, any last words?
I would like to paraphrase Junior from VeggieTales, and God is bigger than COVID-19. Thank you.
Oh, thank you. I love that. I love that you just did that. Thank you to our wonderful panelists. You've been so helpful, and to giving us this time and your expertise. Thank you. Thank you to you at home or office or kitchen counter like I am for joining us. We hope it was helpful. If your question wasn't literally answered, go back and watch this again. It was probably answered earlier. We have recorded this webinar. We're going to post it. It is available. As always, you are, recommended in the highest, strongest ways to follow the advice of the federal, provincial, and municipal health authorities and make your decisions accordingly. Please visit the efc.ca. We have a COVID-19 resource page there for you that we are always updating. You can subscribe to our magazine, Faith Today, now for free, which is published by the EFC, Canada's Christian magazine. You can go to faithtoday.ca to do that. We also have a podcast where we've been doing lots of COVID-related material and also just some general inspiration. So we will call it a wrap, and thank you so much for joining us.
The Evangelical Fellowship of Canada unites evangelicals to bless Canada in the name of Jesus. For more than 50 years, the EFC has gathered Canadian evangelicals under one common statement of faith, which proclaims Jesus as Savior and Lord.
We're the largest network of evangelicals in the country, doing ministry better together.
God calls His church to join in His mission.
EFC is one of 129 bodies that are members of the World Evangelical Alliance. That makes up the global body.
We are 42 denominations,
64 ministry organizations,
34 educational institutions,
and over 700 congregations strong.
In French and in English.
From coast to coast, we are the new face of Canadian evangelicals.
Living out our faith in word and action, engaging our Canadian communities in culture like never before.
L'objectif de l'Alliance évangélique du Canada et d'unir les évangéliques afin de bénir le Canada dans le nom de Jésus.
We join together to bless Canada through our work on Parliament Hill and in Canadian courts, speaking biblical principles of truth, compassion, and justice to the top issues facing our nation.
We don't just speak compassion, we do compassion.
As affiliates, we bring hope and healing across our country and our world.
We come together to bless Canada with cutting-edge research on issues like why youth are leaving the church and how we can help them stay, the role the Bible plays in our lives, who's attending Canadian churches and who is not. It helps us to understand our unique country.
We are blessing Canada in the name of Jesus, and together we respond.
Together we respond.
Together we respond.
Together we respond.
And together we respond.
Together we respond.
Together we respond.
We bless Canada from coast to coast
through partnerships that the EFC forms and facilitates.
When ministry leaders collaborate through EFC, they bless Canada in ways they cannot on their own.
Our award-winning team of Christian journalists examine the issues of the day thoughtfully and compassionately in Faith Today, Canada's Christian magazine.
We bless Canada better together than alone. It's always been so, and now more than ever. Join us.